Role of an occupational therapist assistant and physiotherapist assistant in infection prevention and control.
Hi there. My name is Christian, and I'm an occupational therapist assistant and physiotherapy assistant for the past 5 years. And I'm a graduate from Centennial College.
Hi, my name is Maryse Plourde, and I'm an occupational therapist assistant and physiotherapist assistant student at Centennial College.
What is the role of an OTA and PTA?
So our role is assisting the occupational therapist and physiotherapist by implementing the treatment plan that they have established for the client. These examples include working on transfers, therapeutic agents such as modalities, cognitive functions, cardiovascular system, conditioning, and so on. So we work with a variety of healthcare professionals, not only just the occupational therapists and physiotherapists, but we work with personal support workers, nurses, and dietitians. For example, if a client is aspirating, you are communicating this information to the nurses or dietitians so they could further investigate. And what makes us unique from other professionals is since we are doing a lot of the transfers and treatment, we are there to educate personal support workers, nurses about transfers.
So, like many other healthcare students, we receive training in anatomy, but in our case, with a bit more emphasis on bone and muscle structures, and as well as tendons and ligaments, things like that. We also receive training or learn about things such as proper posture, proper body mechanics when we're giving treatment, cognitive deficits and the related treatments for those things, and mental health, just to name a few. We also need to complete a number of clinical placement hours in order to finish the program. And in those placements, we are supervised by an occupational therapist, a physiotherapist, or an OTA and PTA.
What is the role of an OTA and PTA in infection prevention and control?
As students, we learn about the modes of transmission of infections, as well as the proper personal protective equipment, depending on the mode of transmission of the infection. We also learn about proper hand hygiene and disinfection of the equipment that we use commonly.
So following infection control, hand hygiene before and after treatment is uh, very important. We must wear proper PPE for each client, depending if they're contact, droplet precautions. We have a joint and health and safety committee where we communicate any information related to infection control, and they could further uh, tell the PPE to make any changes. We would disinfect and maintain equipment, making sure they're all cleaned after use. And you're collaborating with infection control all the time, where if you notice a change in the patient's status, whether they're coughing or they have a runny nose, you're communicating this to the nurse and infection control so they could further investigate whether they should place the patient on droplet, contact, precaution, or so on.